Okay, hi everyone. Welcome to the first MedSoc tutorial of the year. We hope you're enjoying fourth year so far. Before we start, we just kind of wanted to introduce ourselves. So I'm Max, I'm one of the clinical education chairs.
My name is Vedika, I'm one of the other clinical education chairs.
And we're just going to be in charge of running with the kind of MedSoc tutorials for year 4, 5, and 6. So we just wanted to let you guys know that if you have any questions or any feedback, there's going to be feedback forms during the tutorial. So please fill them out because they're really helpful to us. And if you have any kind of questions for us directly, please feel free to email us. You can find our emails on a lot of the links we send out. So yeah, we just wanted to wish you the best of luck for fourth year. Hope you enjoy the tutorials and hope you have a great year.
Yeah, we're now going to just hand over to our tutors for this session, Aisha and Samir. And lastly, I'd just like to say keep an eye out on our Instagram as well for more event details. But yeah, I'm going to hand over to those two now. Thank you, guys.
Sorry, my laptop's a bit laggy. Can you guys hear me okay?
Yep, we can hear you.
Okay. Okay, well, my name's Samir, and this is...
I'm Aisha.
So we're both fifth year students, and I don't know how it's been a year already since we were in your position. Time goes pretty quick. But yeah, so we're going to be leading today's talk, which is essentially just going to be going through a few things that we thought would be useful to know at the start of the year, and hopefully get you all a bit more settled in and make you feel a bit less overwhelmed because we know it's a big jump.
Yeah, so we'll just be talking through some of the tips that we think we might have wanted to know at the start of the year, and hopefully these will help you. But if you feel like there's anything that you're wondering about which we may not have covered, we will also have a little Q&A at the end. So just jot down any questions that you have, or just pop them in the chat and we can cover them at the end.
Okay.
So first slide is about finding your feet. And so just want to preface by saying, do not worry if you actually haven't yet. Many others, all of your peers will probably be in the same boat as you. And I know personally, I was really struggling at the start of the year to settle down. And, you know, I was feeling quite overwhelmed. So it's actually really important to remind yourself to be patient with yourself. And it's actually such a different sort of setting to preclinical years. So don't be alarmed if what worked for you before in terms of learning and revision in the past doesn't work for you now. And just try out different revision techniques and find out what works best for yourself. And throughout this talk, we're going to be talking about a few of the options that you could try. And hopefully that will help you get started with finding out what works best for you.
So yeah, just remember guys, everyone is different. You don't have to all do Anki like I know a lot of people do. Of course, Anki is great. You can do different types. You're making it yourself or using James Kai's. Of course, everyone's heard of him. He's a bit of a legend in this medical school. But like me and Aish, we both didn't use Anki. We just did notes and a lot of past med. Everyone's different, honestly. Everyone's got their own techniques. People use textbooks. Some people just spam out the questions. Some people just do Anki because that keeps them kind of making sure they're doing work every day. But yeah, just don't feel pressured by what other people are doing. Of course, take advice from your peers because they might have found something that could work for you as well. But yeah, just don't feel pressured by what other people are doing. For example, my flatmates, they all do Anki, but I'm just like, I just can't do it. And another thing is before tutorials, I'd say, because tutorials can get very boring if you don't know what's going on, especially at the start of the year. I remember I was just like very overwhelmed with the terms they were using. I didn't know what was going on. I was just getting bored quite quickly and I was like, what's the point? So I'd say just read around the topics before you go into tutorials, and it can just make them a lot more engaging. You can answer questions, feel good about yourself, and actually just stay engaged, and you can take much more away from the tutorial. Also, before each rotation, I'd say have a look at the curriculum map on ASR. I did this before each rotation, I was just looking at this, writing all of them up in my notability. So just writing all the topics up, starting a few notes here and there. But I just think that the curriculum map's really good for that because it's got all the core conditions that you should know, which is going to be 90% of your exam. Obviously, they'll throw in a few niche questions here and there because it's UCL, but just familiarize yourself with the core conditions because that's going to be what's the majority of your exam. So, making the most of placement. Most of the time, if you're going into placement early, just enough, then you're going to get your sign-offs done fairly fine. However, if you want to avoid kind of the stress of like cramming it all in the last couple of weeks of the module, then just get them done early. Pester the doctors about it if you need to, they'll do it for you. Just have the cases ready beforehand. So take the history, write it up, and just present it to the doctor at the time of when you want the sign off. Same with examinations as well. Just have the examination done and your notes on it just written up, so you can just quickly speak it to them. And also, junior doctors are a savior in the hospital because they have been through what you've been through very recently, and they know how hard it is to kind of find time for a doctor to kind of give you like 5 minutes just to help you out. So they will help you out if they can. Obviously, the NHS is a bit well, struggling at the moment, so they might be having like long hours. They might not actually be available, but you know, you just got to try, and I'm sure most of the time the junior doctors will say yes to whatever you need. GP is also a great place to get your DOPS and your SLEs, and also you'll get one, I think they're clinical activity forms now, as supervisor reports for us, but you can get one of those every term pretty much from your GP, so that's guaranteed, and it's also one of your GP/consultant ones, which you need 2 of each term. So that's really good. So just remember, GP is the place to get a lot of your sign-offs, and just, yeah, make sure you're not sending them as tickets if you can, because you kind of want to get them done like in person, just get it out of the way. I've had people who haven't done my sign-offs from like first term or 4th year still, so just try not to send them as tickets if you can. And in terms of ward rounds, these can get boring quite quickly because they aren't as interactive most of the time as other things like clinics and theatres. They can be if you get one of the nicer doctors, but often they are quite busy. So only attend them if you find them useful. Otherwise, I'd say just attend a couple during the placement. Don't just be there 9 to 5 for no reason if it's just not useful for you. And yeah, just be assertive when you're there, ask to help out, write notes, ask to do the examinations or any of the kind of small procedures that they do. And they should be willing to teach, to be honest. It is a teaching hospital at the end of the day. So yeah.
Okay, so I'm going to just speak about clinics a little bit. So I find that clinics were a really great place to consolidate your knowledge by seeing it in practice. And it's also a really good place to ask questions about cases quite easily because you have a lot of time in between patients to do so. Well, not a lot of time, but enough time to get some questions in and have a little conversation with the doctor about the case. And in some clinics as well, doctors will let you take histories on your own, which can be quite helpful. And I find that it's actually quite different than it is on a ward setting, and sometimes a lot more useful because a lot of the time it's their first time coming, so you get a fresh history, and because the patients aren't quite as acutely unwell, they're able to give you a lot more concise and reliable history. And I would also say that it's quite important to ensure that you've read up well and prepared well on your topics before going into clinics to make the most out of them. I'll be honest, there are some doctors who will give you it and tell you off for not being prepared. So really make sure you're prepared. It will be very useful for you. Quite often doctors will ask you questions, and if you're well prepared, then as I said, it's good for you to consolidate your knowledge as well as impress your doctors. And as we put on the slides, clinics are a really good place to get your CAFs. So if you impress the doctors, then they'll be more than willing to give you some feedback, and you'll be scored well on your CAFs as well. So this will reflect really well for you when you come to end of module reports. And moving on to theatres, these can actually be really enjoyable, and not just for those people who have an interest in surgery. Personally, I wouldn't say that I have a big interest in surgery or anaesthetics or anything myself, but you know, I felt like I was getting a real hands-on experience in theatres, which I really enjoyed. And again, you have to be quite proactive here and ask to scrub in and practice your skills, etc. This lets you get a closer look into what's going on. You're closer to the patient, you're closer to the doctors, so you can ask questions and, you know, just physically see what's going on. And you're just going to be feeling like you're a lot more engaged as well. And you can ask to like also help as well. You can help by moving the patient or preparing the patient, or even suturing. I got to suture, which was one of the coolest experiences of my 4th year, to be honest. And you can also cannulate and fit airway adjuncts when you're on anesthetics as well. And I just felt that getting more involved leaves you feeling a lot more engaged, as well as willing to ask a lot more questions so you can learn more, as well as just having an enjoyable experience. However, this isn't to say that you have to go to every single theatre and stay there all day. So that's why I say being proactive means that you just don't have to spend hours there, but still get a lot out of the placement.
Okay. Moving on to assessments. So these are a long time away, so don't worry about them for now. We're just going to give you a little bit of advice for them. The main thing is don't try and cram. I'm sure you guys have been through 2nd year exams, so they would have been tough anyway, and I'm sure most of you didn't cram for that. But yeah, this is a long year. It's 11 months worth of content, and it's basically going through everything in internal medicine. So it just makes the exam period a lot less stressful if you're slowly working throughout the year. Obviously, I'm not saying just do like 10 hours a day from now. Just do like, if you don't have a day with placement, then just do a couple hours that day. If you had a 9 to 5, then just chill for that day. You don't really need to do work at this point. But yeah, just make sure you're just chipping away at it, so at the end it's not as stressful. And just remember, when you're doing question banks at the start, it can be a bit demoralizing. I remember I was getting like 30-40% at the start of the year, or just at the start of each rotation, to be honest. And it is a bit, you know, like it does put you down a bit, but you just got to remember that every incorrect question is a learning point. It's not just something to see as a big X that you got wrong and you don't know anything. It's a learning point at the end of the day, and you just got to keep going at it, and your marks will start rising, trust me. And then this is more to do with kind of QuesMed and also other resources, but you can do like time tests. Do this way later on in the year, like towards 3rd term again, just so you're getting used to kind of being in a time pressured environment, and just prepare yourself best for the AKT. And then also at the end of each module, there should be an afternoon or a whole day dedicated to just doing SBA questions with some of the consultants on each rotation for that module. Just make sure you attend those, because they're UCL style questions and consultants have made them as well. And to be honest, they could repeat them in the exams, because UCL does like to repeat.
So I'll just speak a bit about preparation for your CPSAs. Well, everyone I knew last year, they formed little OSCE groups of about 3 to 4 people. And this can just be a small group of your friends or your flatmates. And with these people, just I suggest that you form a plan that slowly increases in frequency every week, how many times you meet every week up until exams. So you'll start off with just like once a week, a couple hours a week, and then slowly increase that to, you know, every day or every other day when you get a lot closer to exams, so like in the month lead up to exams. But having said that, you don't need to start doing this until around start of February time. Most people I knew just didn't start until around February time. Please don't feel pressured to start on this straight away. You're getting your OSCE practice at the moment by just being on wards, practicing your examinations and talking to patients. So that's enough for now. Yeah, I would just say that because there are quite a few examinations to cover, make sure that you're really comfortable with these, because these are for sure going to come up in your exams. And so essentially they can be your easy marks, because if you've, you know, practiced them enough times, you're going to definitely get those marks. So, you know, that with that being said, practice mainly your core examinations, so cardio-resp and abdominal, as well as your orthopedic examinations. And I'd also like to say, don't always practice with the same people. So try to do it, for example, with people in your firm or other OSCE groups, because as good as it is to get comfortable with your OSCE groups, so that you can easily give feedback, sometimes doing it with other people means that they'll pick up things that people in your OSCE group haven't. You know, it's just a new set of eyes, and it also gets you out of your comfort zone a bit, because of course, when you do the actual assessment, you're not going to be doing it with your friends as examiners. So it's really good to just get out of your comfort zone, but you can leave that towards exam time anyways. Yes, because you know that's the time where you're going to really need your good and concise feedback to guide your revision. And in the month or so leading up to the assessment, think about covering all the past OSCE stations. You can find the titles of all the OSCE stations on Moodle, and find stations that are similar to those, because for us, almost every single one of our OSCE stations was similar or almost the same to ones that had come up in the past. So it's really important that you just cover what's been done already. And another tip is, towards the end, bring together like 2 or 3 OSCE groups to run mock circuits. So you can split your group in half, and so half of you run a circuit whilst the others do it, and then you just switch over. So that's good practice for timing and, you know, getting used to the fact that you're doing it all at once. So you know how tiring it can be, and how to pace yourself, as well as, you know, the station that you're examining yourself, you're going to get really, because you're examining it for 4 or 5 people, you're going to get really comfortable with that exam and really confident with that exam. So I just also want to speak a bit about mocks. You'll have a mock AKT and mock CPSA around the end of March or April time. We're actually part of the mock CPSA committee, so you'll see us around then as well. But what I wanted to make a point of here is not to take your mock AKT results to heart and your mock CPSA results to heart, because really it's in place to get to know what areas you need to work on. And just remember that you haven't revised to your full ability yet, and you haven't even done an entire module. So you can't expect to have gotten, you know, top marks. So do you no good to get disheartened. And in terms of the mock CPSA, you'll actually go around and get feedback on every station. So it's more important that you focus on that. Some people might not even give you a formal mark, so just focus on the feedback that you get to improve your skills. And yeah, just take it with a pinch of salt, but let it be the encouragement and guidance you need to kickstart your revision towards exams.
Yeah. Just on that, yeah, so it is basically just for guidance. Remember, just don't get too bogged down with what you get in the AKT CPSA. It can be a bit of a kick up the arse as well, but yeah. UCL, Moodle, and Amnesty. So these are, again, things, Amnesty especially, that's mainly what you want to use towards the end, towards exam season again, because it's got so many past stations on there, which you can do with your friends. It's got a lot of SBA questions. It's got mocks from the past. It's got past papers as well. They're slightly outdated, but there's a lot on there, and they will reuse. They reuse pretty much every year, at least a couple of questions from Amnesty. So just go through everything on there at the end of the year. And yeah, don't neglect Moodle too much. Obviously, a lot of the stuff you can do, you don't need to do all the kind of Rise Articulate stuff. But it is good to do the quizzes, especially on Moodle, because again, they are UCL style questions, and this is what is going to come up in your exam, because PassMed and QuesMed can only do so much for you. So we're now going to actually move on to the resources themselves, so I can talk about them in a bit more detail. So the first few are actual textbooks. Yes, I know, old school, using paper, but actually you can find online PDFs of them now anyway. So the Oxford Handbook of Clinical Medicine, this is a great tool. I actually got the the printed copy. I've not just got it online because I just find it easy to just have it with me when I'm kind of revising or going through kind of PassMed, because PassMed and QuesMed, they can be a bit not very structured in the way they kind of they'll just have some managements missing sometimes, or like the investigations missing sometimes. The clinical handbook pretty much has everything. So if you're ever missing any piece of information, this is where you want to look to, and it explains everything really well and quite concisely as well. I've not actually used the Kumar and Clark's one, but I've heard a lot of good reviews about it. I think it's similar to the Oxford Handbook. And again, you can find online PDFs of this for free. If you guys need to find them, or you can't find them, just email one of us and I'm sure we'll have the link for it. So assess and progress, this is again an Oxford Handbook, but this is one you want to use closer to the exams again. There's again an online PDF for it. So this is really good for, it's just got loads of questions, not like a ridiculous amount, which is why I say use it towards the end of the exam season. But it's just got a lot of questions which have more than one step to it, and it is a bit more similar to UCL style questions. They are tough, so don't be disheartened again by them, but again, just use them as like a learning point, and they explain each answer quite well. I'm sure you guys know about PassMed and QuesMed. These are two things that we both used a lot. PassMed was what we used throughout the year. QuesMed was a bit more when we wanted to start doing like proper questions, whereas PassMed is a bit more, it's more for memory learning, just kind of rote learning all the stuff that you need to know for the year. It's like kind of our version of Anki, I guess. But what I like to do was basically, so I started a Mod A, for example, I would do all of the Mod A questions, and then in Christmas I would reset, and then I'd do Mod A and B together, and then I'd reset again, and then A, B, C all at the same time in third term. So you're kind of slowly stepping your way up in terms of how much you're working. But that's why I say you really don't need to be doing too much at the start of the year. Just try and get settled in before you start like working properly. And like I said, QuesMed is more, it has more steps to their questions, I think, which are slightly more similar to the UCL ones. But they can also be like ridiculously niche knowledge in QuesMed, which you just don't need to know. So again, don't be disheartened by it. But the best part about QuesMed is the time tests, I think, because you can just spam those at the end of the year, just getting used to time pressure environments. And obviously you guys are probably scarred by these stars, but Anki, I probably don't need to tell you too much about it. But yeah, it just works by active recall. You guys know how it works. And also the good thing about Anki, I think the reason why people use it is because it doesn't really let them slack off, because your reviews just keep building up, I think. But yeah, I don't know too much about it. But yeah, so we'll just go on to the next one then. I think CPSA resources.
Okay, so in terms of CPSA resources, I'll start with Life in the Fast Lane. This is actually just good for something for ECG interpretations, which is something that a lot of people do struggle with, and it takes a long time to get your head around. So again, don't be disheartened if you aren't completely amazing at reading ECGs yet, but this is a really good resource to try and start to understand a bit better what's going on. So definitely use that if you're confused about anything you're seeing, well, to be honest, both in AKT questions or in CPSA. This is a really useful resource. So moving on to Geeky Medics, OSCE Stop, and OSCE Hub. These are resources which we've actually found very useful because they have a really extensive range of practice stations. And Geeky Medics, I'm sure you guys have all seen before, is especially one of the resources which everyone finds very helpful. So definitely good to get accustomed with this resource, because as well as having like loads and loads and loads of stations available, they provide really thorough guides in all the examinations alongside videos, so that you can see them in action as well, and as well as the examinations, there are some more OSCE skills that they have guides on as well. So it's just a great all-rounded OSCE revision resource. OSCE Stop similarly also has a lot of stations and guides as well, and has some guides which may not be available on Geeky Medics as well. For example, I think it might have some stations and guides on documentation as well. Although Geeky Medics also does have documentation stations too. And OSCE Hub is a resource which was actually created by ex-UCL students. So this actually has quite a few stations which are based on some of the titles of the past stations. And so these actually could be quite useful to practice closer to exam time. And the UCL Clinical Skills YouTube, I'm not sure if anyone has seen this before. I'm sure you guys recognize Tina as well from Whittington Clinical Skills. This is just a resource which gives you all the clinical skills from cannulation to catheterization, suturing, setting up IV fluids. So, you know, it's really good to just watch these like on repeat in like the month up to exams, to just remind yourself of the skills and go through them with your head before you practice them in clinical skills in the lead up to exams as well on the revision days. And finally, not one that I've included on this page, but there is a document called the Big OSCE Doc, and a lot of us found this quite useful. First of all, to guide our revision and formulate a plan and schedule for exams, so to make sure that we, you know, cover all areas. But it also provided some really concise information, for example, about explaining procedures, or some other OSCE skills, and some examination guides as well. This I found was a very good resource, but you do need to remember that this is a UCL student created document, so you can't let this be your only resource, as it's not totally up to date or in accordance with the current curriculum. But I definitely found it very useful to help me feel a lot less overwhelmed by the sheer amount of OSCE content. Kind of like narrows it down a little bit for you. I'm not sure if you guys have seen it already, but if you ask someone, if you ask around, I'm sure it's circulated. So if you can't find it, just ask someone in fifth year, sorry, and we can pass it over. And finally, just remember to, as I mentioned before, look at all the look at the document of all the titles of all the past stations. And Amnesty also has mock stations as well, so definitely make sure that you do every single one of those, and, you know, do them multiple times as well, because, you know, UCL love to reuse and, you know, do similar style of stations.
Okay, video resources. Do you want to talk about the ones you like? Or?
You can go.
Okay. So 0 to Finals is, I'm sure you guys have heard of this as well, but it's essentially got really good videos with kind of clear summaries of each, most of the main conditions. It doesn't have all of them, so that you can't just use 0 to Finals, but I think it explains all the conditions on there really well. They also have podcasts, which I sometimes would just listen to in my sleep when it was exam season, just so it was just going into my head. But yeah, don't do that, it's a bit weird. Sorry. Oh, right, okay. Yeah, so it also has like, yeah, its own little textbook as well, videos, podcasts. It's got pretty much everything on there. Osmosis, this is also got some really good videos on there, which explain everything really clearly. It's kind of similar to 0 to Finals as well, but I think it has a few more things on there, a few of the niche conditions and things, and they explain it really well again. And separately, these are kind of UCL MedSoc, we're just plugging ourselves a little bit here, and the Splice series. So both of these do really good tutorials. So we'll talk about MedSoc first. So these do really good tutorials, especially towards exam season. I remember I was watching every single one. They'd get past questions up from previous years, and their questions I literally would never have even thought about looking at, because they're not on PassMed, not on QuestMed, not anywhere. They're just UCL specific questions, which I think are really useful for your exams. So definitely attend as many of these as you can. And same with the Splice series. The Splice series, everyone was watching towards exam season. I think Aish likes to watch them at the start of each rotation. She can talk a little bit about that. Whereas I was more just watching it as like a revision tool. So at the end of each rotation, I'd watch them. and they have everything on there. They have SBAs, they talk about the SBAs after each, pretty much go through all the conditions somehow in an hour and a half. And then they also give you OSCE stations to practice as well. So definitely watch the Splice series at some point.
Yeah, seeing as you were just speaking about the Splice series, I'll follow on from that. I don't know if you mentioned that this is a series that is run by UCL students.
Yeah.
So they give very UCL specific tips and UCL specific question types and station types. So I found them very, very useful in the lead up to exams. As Samir mentioned, I also use them for a little bit of pre-reading type style. Like I just watch them quickly, like on 2x speed or something, just to like get a quick idea of what the topics entail, and then I'd also come back to them at the end of a rotation to consolidate my knowledge. But yeah, I find it quite helpful because it's really concise and it's easy to make notes from. So at the start, I might just make a few notes about it, and then as I go along, add notes from say 0 to finals or from past med into like, you know, the bits that I'm missing, I'll put into those notes that I already have a foundation of, if that makes sense. And yeah, I found 0 to finals very, very useful because it has information on almost any condition and has podcasts on them. So I always find it useful when I'm like hearing the words as I'm reading them. So because they have the podcast at the top and then they have the transcript essentially with like, you know, some pictures and stuff, I found that really useful. And as well as the videos, which, you know, give you that visual aid. But yeah, towards exam time, I was definitely like substituting my music for 0 to finals, which I know sounds really sad, but you know, it was quite easy. It was really easy resource to use, and it's free, so can't really get better than that. And then anything that wasn't available on 0 to finals, I tried to supplement with osmosis and resus med as well, because I just, for me, like, you know, learning with videos is really useful, and I know that a lot of medics feel the same way.
Yeah, there's so many video resources out there. Like we can't put all of them. So these are kind of just the main ones that we used. But I'm sure loads of people will tell you otherwise. I know loads of people use Ninja Nerd as well, but his videos are very long, so just be prepared for them. Strong medicine, we didn't talk about much. It's just basically people use this mainly for like ECGs and kind of X-ray interpretations and things like that. Because I really struggled with interpretations in general. Like I just couldn't spot what was going on. But if you just keep going at it, keep watching videos on it, keep practicing with your friends, you will get there eventually, and keep practicing on the wards as well.
Definitely go to the UCL MedSoc tutorials.
Yeah, definitely. Yeah.
Okay, so no, you're starting on this one.
Yeah.
My bad.
Okay. So general tips. So the surgical sieve. I don't know if you guys have heard about this. You might have heard about it. Doctors mention it all the time, but is essentially this is just like a general way to kind of think about differentials. I'm not going to go through each individual one, but you can read them yourself here. I just have a note of these in general. And just whenever like a doctor's asking you for differentials, you might get it in your OSCE as well. I remember we had like a history and then they asked for differentials. You want to be going through the surgical sieve if you're stuck. Just kind of try and think of like one cause from each type of, like each letter, let's say infective causes, autoimmune, you can do cancerous causes. And you'll definitely be able to get at least like 3 or 4 differentials out. Just like churn it out. This is mainly for if you're like stuck and you don't really know what's going on, you can just hazard a guess with these things. And yeah, like doctors won't really ask you for an actual diagnosis. They'll ask you for differentials. And to be honest, a lot of medicine is like doing differentials, getting differentials, and then doing your tests, blah, blah, blah after that. And that's when you get to the actual cause. But yeah, just have this in the back of your head. And get involved when you're at placement. We've mentioned it a few times now, but if you don't ask, you don't get. Don't be afraid to pester doctors. If you feel like it's not helping you, then just don't force yourself to go in 9 to 5 every day. Just take a day off, or just go in for the morning and then take the rest of the day off. Do your own work if you think I'm not really getting much done at placement, and that does happen a lot. So just brace yourself in it for the year.
Okay, and just want to finish off by saying you do have a lot more free time than you think, so do not neglect your social life and your hobbies. Make sure to pay attention to your mental health because you don't want to burn out. That would be the worst thing. So, really focus on yourself and pay attention to your body and to your mind, and keep your social life intact. Remember, this is a marathon, not a sprint. I'm sure you've heard this loads of times. So really be thoughtful about your working habits and pace yourself. But generally, this is the year to, really start getting a hands-on experience of medicine and, feeling a little more like a doctor now. So just try to enjoy yourselves both in and outside of placements.
Yeah. So yeah, just remember it's a marathon, not a sprint. But just enjoy yourself during the year. It is a long year. It's the first time you'll be doing an 11-month year, I assume. So that's why we're saying don't burn out by April, May, because that's where we're usually at our peaks and where we've been used to doing it, exams. But yeah, just go slow. You don't need to be settled in yet. It's only the start of the year and it's completely different to the rest of the last few years of med school. And hopefully you'll start to feel more like a medic this year because we certainly did. But yeah, do you have anything else to say? No. Thank you very much. Do you guys have any questions for us? Feel free.
First of all, this is a feedback form and we'd really, really, really appreciate if you could give us some feedback. We should we put the link?
Yeah.
There is no chat.
Okay. It's fine. Hopefully you guys have got a phone or an iPad. Yeah. I know UCL have given you iPads, so
if you could just scan that. But yeah, we're happy to take any questions. Please ask anything that we might not have covered. Anything specific that you wanted to ask, maybe about our experiences as well, we'd be more than happy to answer.
Thank you, guys.
I just had a question about the Splice series materials. Thanks for your talk, by the way, that was really comprehensive. So is that like a live tutorial Splice, or is it asynchronous recorded things?
It's a series which was recorded a couple years ago, I think around COVID time, maybe 2019 they recorded it. So yeah, it's not fully up to date to the current curriculum, but it's more or less quite comprehensive, and it's quite concise. It doesn't cover everything, so don't let it be again your only resource, but I would suggest that you use it as revision towards a time when you just want to quickly refresh a topic maybe that you did in, like, say, your first module that you've just forgotten. Just like run over Splice quickly, and it should like bring all that information back to the forefront.
Yeah, it's on YouTube, by the way. That's yeah. A few of the MedSoc tutorials in the past are also on YouTube. I think
actually, this year
we're putting them on YouTube as well.
Tutorials will be provided on YouTube.
So if you guys missed them, then I'm sure you can catch them there, or otherwise there'll be a link for the recordings somewhere. Someone in your year will have it.
Another note I want to make is just, share all these resources with your friends as well when you come across them, because deciles don't matter anymore, so you're all in it together. This is a team thing. You're trying to get your whole team through to next year, so remember to share all your resources.
Yeah.
Any other questions?
I just had a quick question about PassMed and QuesMed. I was just wondering, do you think it's worth getting both of them at the beginning of the year, or do you think it's worth getting QuesMed like later on in the year?
Yeah, I was just going to say, so most people do start by getting PassMed. As Samir said, it's sort of like a resource like Anki, where you can just active recall and just do questions again and again. And then QuesMed is better for timed tests and stuff like that. So usually people get that towards the end of the year when they want to like start practicing in test format. Anything you want to add there?
Yeah, so I think most of us actually got QuesMed. In November they do a Black Friday deal. It's like 30% off. So most of us just bought it then because it was a lot cheaper than it normally is. So I'd say wait till at least November. You don't really need it right now. Just focus on doing PassMed because that'll be hard enough as it is to get through. But yeah, I'd say get PassMed now if you haven't already. But QuesMed, you can wait a while. I bought it in November, but I didn't actually start it until second term at least. So
Thank you so much.
that's okay.
Anyone else?
I just wanted to ask about Anki. Do you think we have to do it if we're already doing PassMed?
No, like I said, neither of us did Anki. People do it. I think with Anki, it's because it forces you to do it every day. That's why people like it. And again, it's active recall. But if it's not working for you or you just don't want to try it, just don't bother with it. Like, I've never been like that much of a fan of Anki, but it works for some people. It doesn't work for some. You don't have to do it. We both did pretty well without it, so it's fine.
Yeah. What I was going to say is that it's fine to like also like as we mentioned earlier, like it's fine to just trial a few different revision techniques at this point. I don't think I fully like settled on my revision technique till around January, February time. So don't worry if you've not like something's not clicked yet. It's fine. Like give it a bit of time, try a few different things, and hopefully it will click soon for you. But yeah, Anki I wouldn't say is a necessity because I just don't think I could put myself through it. But some other people swear by it. But also that doesn't mean if you do Anki that you shouldn't do PassMed. I think you should still do PassMed because I think you mentioned should you do both. But definitely if you are doing Anki, I think I would really recommend doing PassMed as well. But you know, you might give more focus to Anki, which is fine.
Yeah, I do think PassMed's a bit more fun. That's why I do it. I prefer like doing a lot of that rather than just literally looking at a card and just clicking. Like I just see all my friends just clicking all the time on their laptops and phones, and I'm like, oh my God, I can't do it.
To be fair, both of them are a bit like a game, so sometimes it's a bit easier to look at them as such. So don't try not to get to a bit like, you know, too bogged down by your marks and everything and how much you're remembering at this point in time. Just kind of enjoy it, I guess.
Yeah. So no, you don't have to do Anki.
Great, thank you. Because I did try it in the first 2 years, never actually went past the second week. So yeah, that's good to know.
So
Thank you.
don't worry about it.
Anyone else? Okay.
Whilst anyone else is thinking of their questions, maybe you guys would want our emails.
We can't drop it in the chat.
We can't drop it in the chat, but I don't know if you can see Samir's surname on the chat, but it's basically samir.gude. I don't know why I'm giving it.
Yeah, samir.gude.19@ucl.ac.uk.
And mine is aishu.jen for November a.19@ucl.ac.uk. So if you want to drop either of us an email to ask any more questions, we'd be happy to take them as well. Yeah. And please do the feedback if you can.
Yeah.
Yeah, any more questions whilst we're on the call?
Just wondering what your next session will be with MedSoc.
I believe it's a session, I think Vedika probably confirm, but I think it's a session on ECs.
So yeah, the next session is on Tuesday and it's on just the foundation concepts for module A. The link will be sent out soon. Just keep an eye out on the WhatsApp group chat and our Instagram as well.
Okay, thank you.
Okay, I guess we can wrap it up then if no one else has got any questions. I'll stop sharing now. Okay. Okay, thank you very much, guys. That's the end of the tutorial. Hope you enjoyed. I appreciate you guys taking time out of your day to watch us, and hopefully we helped. Thank you.
Enjoy your year, guys.
Thank you.
Thanks for the